Ladies and gentlemen, I'm Army Colonel Sunset Belinsky. Today we have for you the Secretary of the Army, the Chief of Staff of the Army, Sergeant Major of the Army, Superintendent from West Point, and the Army's Ready and Resilient Director. This will be a 30-minute conference. We'll take 2 from the phone, 2 in the room. With that, Secretary McCarthy.
Good afternoon, everyone. I'd like to start out this morning by talking about a missing soldier, Private First Class Vanessa Guillen, in hopes of increasing the public's awareness and assistance in finding her. Private First Class Guillen went missing on 22 April from Fort Hood, Texas. In concert with local law enforcement efforts, the Army will continue aggressively searching for her. Our hearts go out to her family, and we will not stop looking for her until we find her. Sergeant Major Grinson and I just returned from a great visit to Fort Benning, Georgia yesterday. We were able to observe basic training operations, which have resumed with risk mitigation measures in place to protect our newest recruits from exposure to the COVID-19 virus. We have moved thousands of soldiers for the last 2 months and have been able to keep soldiers healthy and trained very effectively. What SMA and I witnessed encouraged us as the Army pushes to return to collective training. As we balance global operations, combating COVID-19 on the home front, the Army continues to need a manned and ready force. We will continue to take the necessary precautions to protect the force and will enable commanders the flexibility to make conditions-based decisions. The Army has proposed a risk mitigation framework to the Secretary of Defense so that we can safely return to training operations and begin our summer move cycles. We are working closely with OSD and other services in this task and are close to finalizing the framework. The virus did not impact the country uniformly, so we need to tailor our approach to the reopening. By developing Army-wide standards and protocols now, the Army will help ensure our senior mission commanders are ready once DoD and local movement restrictions ease. Just as if we have taken extra measures with our basic training recruits to ensure they safely arrive into our formations, we are doing the same with the flow of future officers. For example, the United States Military Academy is returning to school in order to conduct the administrative steps, physicals necessary for particular branches, and clearance requirements so that they are able to report to their next duty station. We will conduct the ceremony, much like the Air Force Academy did on April 18th, in honoring completion of their 47-month journey to enter the Army ranks, including at this unprecedented time for our country. So in sum, West Point, OCS, and ROTC graduating cadets are moving towards resuming operations this summer, and training with extra measures of precaution and safety are being put in place. Just a few moments ago, DoD released their annual report on sexual assault. Army leadership is troubled by the trends, and we must do better. Sexual assault and sexual harassment tears at the fabric of our organization. There is no room for it in our formation. Every member of the force matters and is needed to protect and defend the nation. The effort and performance of our people never ceases to amaze me, and we are all incredibly proud of them. Chief, I'll hand it to you for your opening comment.
Well, thank you, Mr. Secretary, and good afternoon. America's Army is adaptive and ready. We continue to provide medical support across the nation, and we have incorporated new measures across our installations in order to operate safely. As of this morning, we have 2,751 total cases of COVID-19. That includes 1,646 military personnel across all 3 components, and out of the military cases, 524 have recovered. We still have 14 of our 15 urban augmentation medical task forces employed. 6 teams are distributed throughout New York City hospitals and the Javits Center. 3 remain assigned in New Jersey and are operating at the Edison Convention Center, the Atlantic City Alternate Care Facility, and provided augmentation at 3 hospitals: Newark University, Salem, and JFK. We have 1 in Stamford, Connecticut, operating out of the Bennett Medical Center, and we have 2 task forces in Massachusetts, 1 in Boston and 1 in Tewksbury. We have a team in Detroit, Michigan, at the TCF Center. We also have a team in Pennsylvania supporting 5 different hospitals and 1 alternate healthcare facility. We still have 1 medical task force that remains unassigned and is prepared to support. Changes are in place at our initial military training installations, as the Secretary said. Soldiers are conducting training with screening, testing, control monitoring, and tactical dispersion measures in place. We are creating the safety bubbles that will protect the force while they conduct training. Last week, we shipped over 800 recruits to our Army training centers and getting them through these new procedures so they can get trained in a protected environment. We're also taking a hard look at how we get back to collective training, both at home station and our combat training centers. During my visit to Fort Polk yesterday, where our Joint Readiness Training Center is, I was able to go over the measures that are being put in place to safely receive units for their major collective training exercises, like we have done at our initial military training installations. We are applying screening, testing, controlled monitoring, and tactical dispersion to create safety bubbles so units can train and operate in a protected environment. Getting back to collective training is crucial, but we need to make sure we have the right measures in place first. Commanders at all echelons are assessing risk on a daily basis and putting the right procedures in place to fit that population and that installation. It's not going to be a one-size-fits-all solution. We're looking at the long game. We're not waiting for COVID-19 to go away. We're putting the right procedures in place so we can protect the force while we train and operate under a COVID-19 environment. We have extraordinary men and women serving in our Army. We must protect the force so the force can protect the nation. We remain Army strong, and we will prevail.
Let's go to the phone lines. Lita, please. One question, one follow-up. Thank you.
Hi, thank you. It's Lita Baldor with AP. And I'm Secretary, why do you believe it's necessary to have the graduation at West Point and bring all of the students? Other colleges and around the country have obviously and high schools have obviously canceled theirs. Will all of the cadets be tested about this? Will those who decide they don't want to go and not risk exposure be disciplined? And is it true that there were that as many as 60% of the cadets have the virus based on projection? Thank you.
Lita, I'll make some comments, and I think we should bring General Williams up to the microphone, and he can answer much of the details related to the follow-on there. We have to bring the cadets back to West Point to begin the process of the physicals they need to take, all of the clearance procedures to clear barracks, get their personal items. So they have to come back to the academy. And we do want to conduct a ceremony to celebrate that 4-year development process, a hard-earned, from that hard-earned experience. So we definitely want to have a small, safe graduation ceremony for them. But they have to come back to the academy to begin the process to become second lieutenants and to report to their first assignment. General Williams?
Thanks, Mr. Secretary. Thanks for the question. The Secretary-in-Chief laid it out pretty clearly. We have to be able to screen, test, and conduct this operation under controlled monitoring. There's a number of tasks they have to do before I turn them over to the Army. They have to be medically ready to join the Army. So it's a series of medical tasks, essential tasks that can only be done at the United States Military Academy, as well as get their stuff. They left March 6th on spring break. They didn't have an opportunity to get any of their gear, so they have to secure their gear, get their cars. But those were lesser in priority in terms of the readiness they have to achieve before I turn them over to the Army. We'll do it safely, and for all the parents and cadets that are out there watching right now, we're going to take care of them. We're going to do a reverse staging and all integration. I know this group is familiar with that term. Cadets will come into Camp Buckner. I'll set up essentially a staging base out there. Cadets will come in there. We're going to route where they're going to come into. 60 to 70% of the Corps will return by POV. We will encourage the other ones by their privately owned vehicle. Some will come back through other means, but we're working on that as well. So they'll come back, they'll stage for 1 day, we'll screen them, test them as the Chief talked about, and then we'll onward move them on to West Point. While they're at West Point, they'll be segregated the entire time. They'll come back in 5 cohorts. No cohort will intermingle while they're there for those 14 days. They'll eat separately, they'll live separately, and we'll make sure that they are ready to join our great United States Army.
Thank you. We'll go to Courtney, please.
Hi, thanks. So more on that. It was. Can you explain when the decision was made to hold the graduation ceremony on June 13th? And can you explain a little bit more about the process? You say they will be tested. I just want to be clear. When you say that, you mean they will actually receive a coronavirus test before they move on to living at West Point in one of these 5 cores. And then what's happening, the ones who are coming back, is it only the seniors who are getting ready to graduate, or is the entire academy coming back? Thank you.
Yes, ma'am. Essentially, it's the class of 2020. They all will be tested. The Army's been very generous. One of the first places that I asked for the ability to test. So I had the ability to test at West Point. The safety bubble that the chief talked about, we've created that. So this isn't a cold start. We've had this conversation with our cadets at their homes right now. So we track their mental health, their physical health right now. I know exactly where all the cadets are and how they're doing. And so we've set the conditions at Keller. We've converted Keller into the ability, if something were to happen more tragically, someone were to get COVID positive, would need more COVID positive and need more medical health, they'll be able to get that at Keller. Our medical professionals, the Surgeon General, the Army staff did a great job providing. So I have Gen X-16's machines. We just got them last week, and we have the ability to test and make sure that safety bubble is there for the cadets.
And over a month ago, Courtney, we had sent the revised concept with the date and how we would conduct these procedures forward to the Secretary of Defense and then on to the White House. But the President had accepted the invitation to speak at the Academy back, I believe it was in February. We were looking at specifically of how the trend was in the state of New York, and that ultimately was the curve flattening, and how were we in a place with much reduced risk of bringing them back to the Academy.
Go to Tom in the room, please.
So you state, Secretary McCarthy, when you say you set the date for June 13th over a month ago, that's fair to say. And then I just want to be clear, General, when you say it's only the class of 2020 coming back, so the other cadets in the other 3 classes are all going to stay home and distance learn until some future time, right?
That's correct. And I'll save Darrell walking up to the podium. Only the seniors are coming back for graduation. The rest of the cadets are not.
Okay, and Tom in the room, please.
General, if you could address this.
Okay.
If you could answer the question about are there cadets required to come back, and if one or more decide not to come back because of the COVID-19 concerns, will the cadets be disciplined, number one? And number two, let's say a family member of a cadet has tested positive, the family's quarantined. Do you want that cadet to come back to West Point and possibly infect others?
The cadets have to come back, as I mentioned earlier, to complete the medical readiness tasks. Before I turn them over to the chief and the secretary, they must come back to do this. I'm confident that our measures were taken offset at Buckner, and our ability to quarantine. They're going to follow all the data we've been doing. I've been following very closely the regional, all the communities neighboring West Point, and also what's going on in New York City. I'm confident that our procedures are going to take care of that. Quarantine, social isolation, wearing masks, that's the way they're going to live for 14 days to ensure that they don't have COVID.
Again, disciplinary action if a cadet decides not to come back?
We treat all of our cadets with dignity and respect, and that's a commander's decision. I've been making decisions like that for all my career, and we'll address that. But I don't anticipate. I cold called 5 cadets yesterday. They're very excited about coming back.
You're still addressing the question, sir. If a cadet decides not to come back,
yes, sir,
will that cadet be disciplined?
Sir, I'm a commander, and we will take each case separately, case by case. I'm not going to make a blanket statement like that in terms of discipline. I am confident that our cadets will come back and graduate. As the Secretary said, this is a culmination of a 47-month experience. They're very excited about it. We're excited for them to do this graduation. And that's what we've been doing since I've been a commander in the Army. We'll make it case by case, sir.
Yeah, can I just add to that, because I think it's really important, is, we're going to live in this COVID-19 environment for a while. The Secretary and I have been down to initial military training. We have soldiers and leaders training soldiers throughout the Army. I was down at the Joint Readiness Training Center yesterday because we're going to have to train, and these extraordinary young men and women that graduated from West Point, they're going to be the leaders. and they're going to have an opportunity to lead these extraordinary young men and women that are coming into the Army, and they're going to have to work their way through this, and that's why we're putting the safety procedures in place so we can do this safely.
Go ahead, Ryan.
One quick follow-up on the graduation. I apologize. The medical prep that they would have to do to come back for anyway, that in theory though could fairly easily be done elsewhere, right? I mean, if needed. I mean, it is. I'm trying. I know you said they have to come back for that purpose.
Well,
but if you had to in extremis, that medical processing could be done at a MEP station or somewhere else.
No, sir, because they have to move through that corridor, if you will, before they get to West Point. I want to ensure when they get at West Point, right, we've set the conditions. As the chief and the secretary said, we've created a safety bubble there. Very confident in the great medical support we have there. Very confident in the, and we've all, we've been living in this. The cadets are not there right now, but there's a community right now that's at West Point, and we're operating in this way. We are quarantining folks. We haven't isolated anybody, but I've set up quarantine and isolation facilities at West Point. We have all the medical help we need. We need all the testing we need. So I'm very comfortable that they'll be able to come back. But they need to do that before they come on to West Point. So having it done at their home station or wherever they are right now, they need to do it while they're at West Point.
And then just, sorry, not on the graduation, more broadly, just on a different topic. You went to virtual recruiting a while ago. What's the impact on that? Do you have enough data now to see if there's been a huge drop off, any impact in terms of the number of folks signing up? And then related to that, are you still pausing shipping from areas that are hard hit by coronavirus, like New York and things like that? Are you still not shipping people to initial military training from those areas?
Well, yeah, I'll take on the recruiting side. We're watching it closely. I mean, there is a little, a slight dip, but so far our recruiters think that they're going to be able to make that up. I think the country is looking at where we're at right now and the procedures that we're putting in place. And again, I think we're committed to making, as things change and the situation changes, we're taking the proper procedures. The thing on the hot zones, and I think the superintendent was talking about this, every single person we're going to look at as an individual. So if you're sitting in a hot zone and your family has it and you're quarantined, well, then that's not the type of person we probably want to bring through, and would take the appropriate risk measures. So when we look at the shipping, it's the same type thing. We don't necessarily want to bring someone in from what we would call a hot zone. Now, having said that, you really have to get down to the specifics. And I was down at the Joint Readiness Training Center, which quite frankly is in Louisiana, and it's closer to a place that's been hot, but they are not hot right now, not hot at all. And so every single situation is different, and one size is not going to fit all. And I think that's what we expect our commanders to do, is take a look at, if someone was not able to come back, if someone wasn't able to ship, how would we take care of those soldiers? And that's what we tend to do.
We'll go back to the phone lines, please. Idris?
Okay, thank you. Quick question on the vaccines, if you could provide an update on that, and sort of what timeline are you now looking at, and what stage are you at currently? Thank you.
The chief and I got an update on that this morning from the Medical Research and Development Command scientific team. So if you look at the entire universe today, there's about 150 vaccines candidates worldwide. But over half of them do not have the maturity to really be in the pursuit right now. What they described was there's about 10 or 15 globally that are at various stages of maturity, from primates to small animals, leading up to clinical human trials. There are some that are entering human clinical trials this summer and in the early fall. And what the Department of Defense does in our business model, we have a candidate that's within that top 15. But we can also do, because of the nature of our lab network, we have a very unique capability where they can test the aerosol, where you can see if someone sneezes or coughs and they have their, it gets into the air, how much it travels. Many major corporations work with us in their development model. So what we do is we can double down and invest in the fastest horse, if you will, in this 15 candidate race. And then that compresses the time frame that will ultimately get you to the answer and bring a vaccine to life. So you'll hear ranges of how fast it can go. What's exciting about this is that there are vaccine candidates in human trials right now. Much of the work is to be done in the fall, And if you're successful, then it's the speed at which you can scale with large pharmaceutical firms around the world. But you see a lot of energy in the news with GlaxoSmithKline and Sanofi entering joint ventures. There are a lot of world-class companies that you can see are posturing towards scaling one of these lead candidates. So it's moving faster than probably any point in history because of the extraordinary collaboration that's going on today. Very exciting news, but a lot of work in front of us. Chief, anything else?
No, I just think that you can save time by taking risks. You know, you talk about manufacturing and things like that is, you know, you may get ready to produce something and that horse may not get to the final race, and that may not be the most efficient use of money, but by taking risks, you can really move things very, very quickly, and that's what they're doing. Everyone is moving very, very quick at the speed of relevance because everyone wants to, you know, I want to say win this race, but they want to get to the end, and our scientists and all the scientists around the world are working very, very closely, and it's not the normal linear process. That's what they explain tomorrow. They're coming from all directions. They're working together. Some have strengths in testing. Some have strengths in manufacturing. Some have strengths in the vaccination that they had has already been through trials for something else, and they can modify that and move it to it. And all those are coming together because everyone wants to beat the virus.
We'll go to Mary on the phone, please.
Sorry.
Idris, if you have a follow-up, go ahead.
Yeah, just a quick follow-up. The administration's talked about Operation Warp Speed, which is sort of speeding up the vaccine process. Are you looking at speeding up the process at Walter Reed?
Many of the scientists that the chief and I got briefed on this morning, they are supporting the president's task force. If you really look at the alumni of the Medical Research Development Command, Dr. Birx had started there, Dr. Fauci, all of our scientists, Dr. Majarid, Dr. Nelson Michael, they're all worked together over the years. So U.S. Army is central to the support of this effort.
And now Mary. Nothing heard. We'll go to Lucas in the room.
Gentlemen, what do you tell people who say this is just nuts, bringing 1,000 cadets from all 50 states back to New York, an hour away from the hottest of the hot spots, to conduct a graduation that could just be done virtually, like the Naval Academy?
Lucas, we are, these, as we've talked repeatedly here, we have to bring the cadets back to start the process to get them to their initial duty assignments. So there are tasks they have to perform at the academy. But what I would tell anyone is that the U.S. Army is putting the procedures in place to move soldiers from every corner on the planet, whether it's to basic training, towards deployments. We are finding our way to lead through this. I think the United States Military Academy is but one example. There are thousands of young men and women over the last couple of months that have got on buses and on trains and on airplanes, and they've gone from every corner of this country to our installations. And we're going to continue to do that. To the chief's point, it may be a while till we get a vaccine.
Yeah, we can't telecommute to combat, and our troops need to be ready to go. And what we need to do as leaders is put the appropriate risk measures in place, and we're going to do that at the United States Military Academy, and that's why they're getting the screening, that's why they're getting the testing capability, and they're going to put procedures in place that we're using around the Army to continue to train. And we want to create a safety bubble at West Point.
And just a quick follow-up for the soup. Is Beast Barracks going to be delayed, and is it also going to be shortened to like 3 weeks?
Sir, Beast Barracks or the reception of the class of 2024, I have not made a decision on the timing of that right now.
Tara in the room, please.
Thank you. Yesterday, Secretary for Personnel and Readiness suggested that not all the services are going to meet their end strength goals this year with the pressures of COVID-19. I was wondering what your level of confidence is that you will meet your end strength goals and your recruiting goals. And then if you could give us any sort of numbers on how many recruits you've been able to sign up since the stay-at-home orders were given in early March.
We had momentum. We were, I think, how much ahead, Chief?
Yeah, we were about four. This year we came out of the blocks very, very quick. I don't know if somebody want to touch that, but we're about 4,000 or 5,000 ahead.
So we had margin going in, yeah.
So we had margin, and that was on a much higher mission than we actually need. We actually give our, I don't want to say, the recruiting command, we always give them a much higher mission than we actually think we need, because we always plan for the worst case. If our attrition was higher, so we don't get to the end of the year and find out that attrition was much higher than we expected, So we give them a very, very high mission. And then as we get through the year, we start to look at it. We get a sense of who's staying or who's going. And I don't know, Sergeant Major, if you want to talk real quick about who's staying. Why don't you come up and talk real quick about who's staying and the changing that?
Yeah, we've seen an increase in retention. We're over 100%. We met our goals, I must say March, April on our retention goals. And then we had another goal. It's all about the end strength. Like the question you're asking is, so I said, okay, can we get 2,000 more quality? The quality is not going to drop. Can we get 2,000 more quality soldiers that we're going to ETS in this, 4 months to stay? So 2 weeks ago, we had already had 500. So for the retention's going well. And then we said, well, that's long term, but does anybody want to stay? And then we had 200 to 300 that say, I want to extend up to 3 months or to a year. So we're seeing the extensions go well. We're seeing the retention is high. And from the recruiter side, I think it's just going to take time. The virtual recruiting is actually going well. We're learning as we go through this, and as we ramp up the system like we were at Fort Benning, and the confidence that we have to protect our families and our soldiers, I believe that's going to increase. What I said yesterday at Fort Benning was, this is one of the safest places. We're controlled. It's disciplined. I hear these discussions about, the families in West Point, and I say, well, the soldiers are still doing exactly what you just said, and we're going to continue to do that safely, and we were going to protect those soldiers because that's what we do.
And with the end strength numbers and the numbers that have decided to remain, do you think that COVID-19 is the primary factors? Do you think because of the uncertainty with the economy, they'd rather stay around for a while?
I think it's all of the above. I think, again, people are taking a look at what it's like on the outside. They're taking a look at, hey, if I've got some great benefits. It's amazing that people even want to come back in. As you know, we're bringing people back into the service. And there's a lot of people out there when they take a hard look at it, they go, well, I have a purpose. I'm really making a difference here. Or I got out and I really missed the fact that I was part of something bigger than myself, and I was on the world's greatest team, and I want to come back in. So for me, it's too early. I'd like to give you a number. Hey, we're going to be at 4 whatever, 86 or exactly, and those type things. We're going to recruit exactly that number. I don't know yet. But I feel very strongly about the people that are serving and the people that want to come in. And like I said, I was just down at Fort Jackson. I saw the troops down there and these young men and women that come in the Army, and they're training through the COVID-19 virus. It was very, very impressive. I don't know if you want to add to that, Sergeant Major.
Even in January, February, I think it was 3 or 4% unemployment. Our retention rates were well above what we had given the missions for the units. So is it due to COVID-19 or why they're staying? We like to say that the Army is just a great place to work and we take care of our people. But even when unemployment in December, January, and February were at the lowest, we still met our retention goals.
Now, when I was in Detroit with General Martin last week, we sat with the recruiting battalion commander and sergeant major, and their numbers are going up because there are soldiers all over Detroit responding and helping the population. And they think there's directly attributed to that. There could be the elements of the economy and others, but it was hearing it from on the ground to see that the numbers are on the uptick. Clearly, there's several of those factors that are related to the increase.
If I may follow up, just one West Point question that we didn't get to. If one of your cadets is coming back from a hot zone, their family lives there, one of their family members is tested positive, is it worth it to bring that cadet back for this, or maybe process them later after graduation?
Yeah, I think what we're going to do, and I can defer to Darrell, but I think it's going to be individual. I think what you have to do is every individual is different, and West Point does this all the time. There's some will graduate, some will not graduate. Every soldier or cadet is handled as an individual, so we'd have to see what the case is. In some cases, I feel really comfortable with the procedures we've put into a lot of our posts. I mean, if you look at what happened in South Korea, you look at what happened in Italy, the safest places to be were in the military, in those bases. And quite frankly, if you look across the country, in a lot of places, we have the ability to provide the medical care, to do the testing and screening that can really safeguard these young men and women that are coming in the Army.
Just a quick follow-up. Did Governor Cuomo give his blessing to bringing the cadets back?
We contacted Governor Cuomo's office and informed him that we were doing that, so I feel comfortable that, but you're exactly of your question, did he give his blessing? I don't know, but I talked to his office personally myself and said we were doing this.
We'll go to the last question on the phone lines. Eric Schmidt, please. Hearing nothing, Mr. Secretary, I'll turn it over to you for closing comments.
As a reminder to everyone, the Army has executed 2 major globally integrated all-domain, all-compo operations in just the last 4 months. In response to crisis in the Middle East, on January 3rd, the Army helped prosecute the removal of Qasem Soleimani, who was responsible for at least hundreds of Americans and thousands of Iraqi deaths. As a part of that, a battalion of the Army's immediate response force, from 1st to the 82nd, with 2 17 loads of soldiers, went wheels up, headed to the Middle East within 20 hours of notification. The rest of the brigade was in there within 7 days. So obviously we remain prepared anywhere, anytime when the country needs us. In this time, we've reordered our global gift map deployments to meet CENTCOM CG's needs in Iraq, Afghanistan, and the Middle East while mitigating the COVID crisis here at home. In the homeland, Army North has set the theater across the United States by providing enabling and foundational capabilities that only Army could provide, which includes support of the Army Corps of Engineers. We've rapidly deployed 4 active duty field hospitals to New York City and Seattle within days in support of FEMA. We mobilize our reserve medical capabilities, allowing those already in the community to fight to remain by deploying 14 urban augmentation medical task forces to directly support FEMA and HHS and the communities that are in need. In addition to more than 150,000 soldiers we have across the globe, helping protect our country and work with families and our allies and partners, we've also supporting the nation's COVID fight. 33,500 active duty, 37,700 Army National Guard, 4,500 Army Reservists, and 1,400 Army Corps of Engineers, military and civilians, all against an invisible threat that we have never expected to fight. Clearly, we're in very good shape with strategic readiness. I'm very proud of that. Thanks for your time today.